Thanks so much for joining today. My name is Emma Kenyon. I'm a member of CanChamHK and Associate Director of Asia Care Group. We are a specialist healthcare advisory firm based in Hong Kong. We work with clients from across the healthcare sector, including insurance, pharma providers, government, development banks, and NGOs to develop strategies to address challenges they're experiencing in the region. Welcome to our webinar, Managing Mental Health, How to Support Your Employees. This webinar is brought to you by the Women's Network and the Canadian Chamber of Commerce in Hong Kong, a nonprofit, non-governmental organization founded in 1977. Today, we have over 1,400 members representing nearly 300 companies, making us one of the most active international chambers in Hong Kong and one of the largest Canadian business organizations outside of Canada. We deliver 4 services to our members: representation and advocacy engagement, business promotion, networking, and brand exposure, learning and training, and information and insights. This webinar is the first of a 3-part series that covers a wide range of topics and perspectives about mental health. Today's webinar will address issues of mental health in the workplace. By the end of this session, we hope you have a deeper understanding of the challenges employees and their families face during the pandemic, particularly access to mental health care, and the different ways in which employers are supporting their staff. If you have any questions during the webinar, please submit your questions or comments in the chat box, and I'll either bring them up during the discussion with our panelists or have one of our experts answer them during our Q&A. So without further ado, let's introduce our speakers. And we can kick things off with Pierre N, AVP Health Product and Provider Management, Manulife. Pian, do you mind introducing yourself to the group?
Just unmute myself first. Hi everyone, I'm Pierre N. I'm the AVP of Health Product and Provider Management in Manulife Hong Kong. I have more than 15 years experience in insurance industry for both individual and group business, spanning from health product development and as well as claims and operation. I'm also a deputy chairman of a medical association, insurance association under the Hong Kong Federation of Insurance, Federation of Insurers in Hong Kong. I have previously heavily contributed to the development of VHIS with Hong Kong government. It is a very critical milestone for the Hong Kong medical insurance market for all the Hong Kong citizens. And Manulife is one of the major insurers in Hong Kong. Since our operation started here in 1897, it's already 120 years ago. And we offer a wide range of protection and wealth insurance products, as well as service to both individual and corporate customers in Hong Kong and Macau. For individual, we offer a full range of health solutions, which from the basic traditional medical plan to a higher medical plans. Our product enjoy a good reputation, and we win a lot of prestigious awards from different associations such as iMoney and Bloomberg, and as well as the Hong Kong FI. For group medical, our offering including basic medical package medical plan to the full flexibility tailor-made medical plan, as well as free choice plan to fit each individual needs. We are also the biggest MPF provider in Hong Kong. That means we are the one can provide reliable one-stop solution to help the customer for all the group insurance products as well as pension and MPF. We look to introduce holistic insurance and financial solutions to help our customer to make their decision easier and life better. Thank you.
Thank you so much. And I think we're all looking forward to hearing your perspective today. Next, we have Hannah McLeod, Head of Marketing and Strategy at the City Mental Health Alliance. Hannah?
Yes, thank you, Emma. It's nice to be here. Hi, everyone. As Emma said, I'm Hannah McLeod. I'm the Head of Marketing and Strategy at the City Mental Health Alliance in Hong Kong. For those of you who might not have heard of us, we're a non-profit, membership-led organisation, and our vision is to create mentally healthy workplaces. So we have 4 key focus areas. One is research and data, where we deep dive. We provide surveys and reports on workplace topic of workplace mental health. We provide resources and toolkits to ours, events, and also some training. So we have about 23 members across all different sectors. I'm sure many of them are members of CanCham, but yeah, main sectors I would say were banking, insurance, law, and real estate at the moment. So it's really great to be here. I'm looking forward to the conversation.
Thank you so much, Hannah. And last but not least, we have Dr. Gordon Wong, psychiatrist. Dr. Wong, do you mind introducing yourself to the group?
Thank you very much. I'm Gordon Wong. I'm a specialist in psychiatry in Hong Kong. Apart from being a psychiatrist, I also like to do psychotherapy. For example, I do hypnosis, I do mindfulness, and I also like to talk, and therefore I also have a master's degree in counseling. Apart from doing these, apart from work, I like learning languages. So I've learned Spanish, German, and Japanese for 3 years. So can't say I'm proficient, but I'm definitely interested in learning languages. So, well, that's all for me.
Thank you so much. I think you probably put many of us to shame already. I think I'll start with you if you don't mind. I think it would be really helpful if you could kind of lay a foundation for us today in talking about mental health or mental ill health. I think many of us have started to learn some of these terms a little bit more over the past couple of years, but we may not fully understand, what it means to have good mental health. And we may be familiar with stress or anxiety, which can occur periodically in our lives, but not be fully aware of some more serious mental health issues such as depression or requiring medical intervention. So could you just give us a sort of overview sort of about what we mean when we talk about mental health?
Right, so to have an overview, we need to have a definition of health first. So the definition of health as defined by the World Health Organization is a complete state of mental and physical well-being. So health is not just physical health, but also mental health. So for mental health, we are not talking about the absence of disease. We're talking about a state of well-being. So obviously absence of disease would be a factor for health, but that's not enough. So we need to have a sense of well-being as well. So for example, when we do have stress, so stress is unavoidable in our life. Therefore, so basically the reason why we have stress is that basically when our expectation is different from the reality, then we become stressed. So the manifestations of stress can include some bodily symptoms, for example, insomnia, palpitations, changes in appetite, headache, muscle tension, and there could be some cognitive symptoms such as ruminations, negative thoughts, poor concentration, poor memory, or people find it difficult to remember things, difficult to think clearly. There could also be some mood changes. So it could be irritable, anger, worries, disappointment, low mood, panic, or even emotional numbness. Or there could be some behavioral symptoms such as being impulsive, wanting to withdraw from social life, like not replying to messages, not meeting friends, or having low motivation, daydreaming. So these could be symptoms of stress. So when stress becomes too much, then it decreases our work performance. So there is this thing called the Yerkes-Dodson law. Basically, it says that the more stress we have, so the body gets more aroused, more alert, and therefore this increases performance. However, stress only increases performance up to a point, and then it starts to decrease performance. And therefore this bell-shaped curve is called the Yerkes-Dodson law, which talks about the relationship between stress and performance. So we need to find this balance of optimal stress level to have a good level of performance. So when the person is too stressed, then the performance decreases. interferes with daily functioning. Therefore, it becomes an illness, becomes stress or anxiety disorders.
Thank you so much. I think a lot of what you mentioned there actually feels very familiar to me, particularly over the last year or so, when we've sort of been living in a period of, I guess, sort of increased uncertainty. And I think many people are feeling worried about their families. Maybe they've been separated from their families or family members for a lot longer than they expected. Maybe they're working from home or working flexibly, and it's not as easy as it sounds. So I wonder if you've seen, more patients or more people talking about kind of chronic stress, that initial acute stress, but it doesn't sort of go away after a while. And if you could talk a bit about that.
Thank you. So indeed, I've been seeing lots of stress-related disorders in the past few months. So a lot of people, they find that they could not concentrate, or they feel that their social life's robbed, that it has been robbed because they can't go out, they can't meet friends, they can't go to the gym. And there is just basically the daily life is just turned upside down, and people just don't get used to it. And people thought it was going to go, but then it just, the pandemic just kept on and on and on. And some people just sort of lost hope in having a normal life again. And in the past few months, more and more people have sort of given up on having this normal life and become very anxious, and some became depressed. So I do see a lot more mood problems in the past few months.
Thank you. Maybe Pian, I'll bring you in here. Have you seen, a shift, I guess, in the needs and expectations of employers who are offering employee benefits, health benefits to their staff? I know traditionally in Hong Kong, mental health is not covered under standard plans, but are you seeing a shift in demand for mental health benefits?
Can be yes or no, and always depend on the size of the company. I can see two trends development for the global company or big size company. Yes, they will ask for the mental health coverage or check whether we can offer some mental health coverage to their employee or dependents. But for some local employer, I have not seen any trend or increasing for asking mental health support at this moment, or because the financial problem at this moment, they may not pay focus on this benefit. Yeah.
Okay, so this could be tied either to a sort of lack of internal demand within these companies. Maybe their employees aren't indicating that they would like this coverage, or on the other hand, companies right now are very aware of their spending and are might be reluctant to expand coverage.
Yes, I think also both, because if you ask for mental health benefit, unavoidable, we will charge more. And then, but however, if also on the other hand, we can expect that if the customer, the employee can keep good mental health, and maybe they can increase their possibility and provide a good performance in the job. And it can both help for the company to keep the business and their employees' healthiness. So however, the usage rate, even I add this benefit in the medical plan, I don't see any increasing in the usage rate from those employer. Maybe still in Hong Kong is a Chinese society. People still get some negative image for mental health. They are not willing to let their employer know that they are suffering from mental health. So recently, not only for treatment mental health, we also provide can advise some mental health check-up service to the employer to offer to the employee. Still, prevention is much better than treatment. So it will not act as a stigma to the employee they are suffering from mental illness, but it's just a wellness checkup. But for mental wellness checkup, we need to know and see how is the usage rate of this kind of service.
Interesting. So in some cases, you might see people who require some kind of mental health treatment, but they sort of have to go around it and use wellness or something instead to get access to care. Hannah, you obviously work very closely with a number of employer groups in your own membership. I'm curious about how the focus at City Mental Health Alliance might have changed over the last year, or if you're seeing employers kind of focusing themselves on kind of specific areas of interest related to employee mental health.
Yeah, absolutely. I mean, we were set up in 2017 by our CEO, Dr. Zoe Fortune, who's still with us today. And luckily, we were set up to be small and nimble. And luckily, we can be responsive to change, because since we've definitely seen amongst our members, since the social unrest and COVID, so since 2019, we've seen a light being shined on workplace mental health. It's definitely gained momentum amongst our members. And we feel slightly biased, because obviously if you're a member of the City Mental Health Alliance, Hong Kong, then you're going to be slightly biased towards wanting to, raise awareness of this topic. So it's really interesting to hear what Pian's saying around cultural society and how it's referred to, because our members are the ones that are putting their hands up to say, we want to make a difference in this area. So I guess our focus is aligned with member need. So for example, at the beginning, and still slightly is, but in the beginning of 2020, there was a lot of uncertainty around working from home. Everyone seemed to be doing different things. So our event focus evolved. So we ran sharing sessions all of a sudden, discussing strategies. And really this year, our events, really are focusing one way or another around COVID and the implications of that. So our event focus has definitely evolved. Our research focus evolved. We were doing a research survey, an annual survey anyway. We decided to add COVID questions to that survey. So we reached 1,500 employees around workplace mental health. One of those key findings were that employees value flexibility and autonomy. So again, it's around working with our members and companies to best support that. Our resource focus definitely evolved. We've put out a lot of specifically related resources supporting employees through uncertain circumstances, including quarantine, the most recent one, which I think I'm going to talk about a bit later. And finally, our training focus evolved. So we're now adapting people going back to work and back to the office in whatever way that looks like. So for example, our latest module is around transition to workplace. So going back to the workplace and what that looks like for different people. But for Dr. Wong's point around people feeling stressed and it being going on and on and on completely. And we held a senior leader panel just last week talking about this. And one of the senior leaders was saying one of his tips for for employers this is a marathon, not a sprint. So you need to just lock yourself in and just, don't waste too much energy too soon. It's a long-term thing, and just put, and pace yourself basically like you would a marathon. So that was his advice, which I quite liked.
Thanks. And following on to that, I guess you've talked about how you're sort of shifting your focus in response to your kind of member needs. And I guess I wonder, what are some of the challenges, I guess, that they have brought up that have sort of required or necessitated this shift? What are some of the concerns that they have about their employees during this time, or even, more broadly? I know we focus so much on COVID, but if there are other issues that they've been sort of, trying to manage over the last 2-3 years even.
Yeah, absolutely. So I guess in the first instance, it was working out, and there's many terms, remote, blended, hybrid, all these kind of working scenarios. So I think the first thing they did were to find out what flexible working policies they have. And it's so interesting because some didn't have one at that time. Now, I think I could say that was probably the biggest improvement amongst our member group, is that I'd say nearly all of them now have a flexible working policy that's been put into practice. So that's a massive change, because some didn't have one. Secondly, was very practical. They were being asked by their whole employee base, what can they do around supporting mental health? So it was around the support provision. So looking at their employee assistance program, what mental health coverage was supported there, their insurance cover, and as Pian was just talking about, what mental health coverage it was in their packages, or what help is available to them. Their training strategies were suddenly being kind of reviewed, and has anyone had mental health awareness training? Do they need it? Do we need to look at specific groups, for example, managers, which are very different from new starters? We were asked to develop specific COVID modules around managing stress and working in uncertainty and virtual working. They also, a few of them already had in-house psychological services, so in-house counsellors, or whole medical teams. Some of the bigger banks, they have kind of the whole suite, and they were reviewed to look at how to support suddenly remote workers. So it's the virtual, everything going virtual, but also some companies, that didn't have that service were reviewing whether or not to get it. Other quick things, just it was included, how new joiners came into the company. Obviously, lots of people started without ever setting foot in an office, meeting their teams in person. So navigating that and how to support the mental health and well-being of those employees. You mentioned before people were struggling. We identified presenteeism as one of our key findings of our research. So we define presenteeism as turning up to work despite experiencing mental ill health. It was quite a big percentage of our survey. And obviously that's kind of moved to remote presenteeism. So we're kind of talking about how to manage remote presenteeism now and what the stress points might be that you can't physically see people. And finding now, the challenges right now are, people are going back. So what that looks like, how can we keep people physically and psychologically safe? How do we support people in different circumstances? And I'll go on, I won't go on, but there's a big group for us are middle managers. They're really feeling the crunch that comes up in our survey. A lot of people discuss the role of managers, and just making sure they're equipped to handle that they're trained, that they have awareness training, and that they look after their own mental health as well. That's really key.
Thanks. I think it's so interesting that a lot of your members were getting requests from their employees to know what their mental health benefits or services that are available to them are, because I think that probably isn't something that was happening a few years ago. I don't even know if employees would know to ask those questions. So I think that probably signals a pretty significant shift on its own. And maybe something that isn't widespread among many companies, but it's great to see that that's something that's happening. Dr. Wong, maybe I'll come back to you. In your practice, and just as a psychiatrist practicing in Hong Kong, what are some of the challenges that people might face when they're trying to access mental health services in Hong Kong?
I think for the expat community, so I think the main challenge would probably be trying to find information on how to access service, because I think most of the information is in Chinese. So I think step one of the challenge is to find information. So if people wanted to access the public sector, services in the public sector, it can be challenging because public sector psychiatry service needs a referral from a doctor. Then you start to go into the queue, go into the waiting list to have an appointment, outpatient appointment. So that could be a daunting process. Otherwise, if people don't want to go into the public system, then they can enter the private system, and that would be a lot easier. But then I guess the barrier would be cost, because the cost is a lot higher compared to the public service.
Just out of curiosity, do you see many people, because of these challenges around accessing care, just sort of delaying accessing care, perhaps to their detriment?
I think in the expat population, probably no, because I think I guess most of the time when people do see me, then they already have overcome the barriers. So I don't really see that in the expat population, but then in the local population, there are some barriers, even though the public sector services are very cheap, and in some cases in most cases heavily subsidized. There are still some barriers of access that people still find that very low cost, the low fees are prohibitive, and they don't go to see doctors. Another potential barrier is the stigma around mental illness. A lot of people don't want to go to a psychiatrist because of the stigma attached to mental health. And I've also seen cases in the public sector where they really don't want to see a doctor because if they have a mental health record, then they can't buy certain forms of insurance, of health insurance. So that is also a barrier to accessing service.
Thank you. Pian, I'd like to get back to kind of insurance coverage. I think you touched a little bit on perhaps the fact that there isn't a significant demand that you've seen, at least in the kind of local insurance market, for enhanced coverage for mental health. But I'm wondering what some of the challenges would be from an insurer perspective in increasing these benefits. I know that the Manulife is obviously a really significant player in the market, but Hong Kong is a tough insurance market to be in. It's a very saturated market. It is hard to, it's hard to sort of operate and make really any kind of profit. It's very tight. And medical costs, obviously, in Hong Kong are quite expensive. So I just wonder if you could talk a bit about why insurers might be hesitant to enhance their benefits.
Yes, for the Hong Kong medical course, it's the top two in the world. The first one is US, and then the second one is Hong Kong. The inflation rate for the private service is about 5 to 10%, depend on different categories. So the most challenging thing is the cost, because when I share with you, the usage rate of this kind of mental health benefit is quite low. When the employer asks to add this benefit to their employer, and then they will check for the price. And then the price is so high because the mental health private session in Hong Kong is quite expensive when compared to other medical care. So we cannot add this benefit with minimal charge. We need to pay to the actual medical cost. So when the employer check with the usage rate, they will find that this benefit may not be very helpful because the usage rate is quite low. So just I shared before, and coming soon, we will share more about the basic mental support, such as the wellness checkup or some counseling course, because we don't want the client or the employee to get medical certificate about a mental illness. We just provide some basic wellness program and make them can live more mental healthily. By doing so, it can make the employee more easy to accept this kind of service. Another way is the awareness of the mental health. Sometimes people are very busy to keep working. They are not care about their body. Mental health, it may not easy to recognize by the people themselves because they think that I'm too busy. Maybe I can get some headache, or I'm too busy, so I forget anything, or I'm so busy, so I'm easy to get angry, or something like this. So it is a transformation project or a long journey to help the people or public to more awareness about their health problem. What is the sign and symptom of the health problem? If this happens, they need to get more attention to their health problem. It's something like that. I think this is the most challenging things at this moment. And we also want to work together with the employer or our customer to have a more understand and awareness of this kind of mental health. Thank you.
Thanks, Pian. Dr. Wong, that sort of brings me to another point. You spoke at the very start of this session about some of the signs and symptoms of someone who is experiencing mental ill health in some way, maybe that's stress or anxiety. I wonder if you could talk a bit more about how we can identify some of those symptoms in ourselves or in others. You know, Pian talked about people might feel they feel physically ill, but they might not connect that to actually some kind of stress or anxiety or depression that they're feeling. So what do you typically advise to your patients to help them better understand these signs and symptoms?
Sure. So I think the number one misconception about depression is that people think that depression is just sadness, and a lot of patients I see who are depressed, they say that, oh, when they tell their friends they're depressed, they're sad, then the friends just tell them to go exercise, go for a walk, then you feel better. But depression doesn't work like that, because low mood is just one of the symptoms. So depression is a collection of symptoms that lasts for at least 2 weeks of pervasive low mood, meaning like feeling sad all the time. And also the person is unable to feel any pleasure. Other associated symptoms include poor appetite with weight changes, poor sleep, feeling very tired, lethargic all the time, feeling having poor concentration. They may be agitated, so they may be irritable, or more commonly, they have something called psychomotor retardation, meaning their thoughts are slow and the actions are slow. They may speak slowly, and people may also have negative thoughts. They may feel useless. They may feel worthless. They may feel that they are a burden to other people. They may find that there is no hope. They are helpless, and they may even have suicidal idea. So these are symptoms of depression. So it's not just, so these symptoms don't just go away by going for a walk or watching a film or think happy thoughts. So depression is an actual illness that needs treatment. So it's not just go for a walk or do some exercise that would alleviate depression. So as for anxiety, anxiety is also a problem, which a lot of people don't realize, because there are a lot of anxiety symptoms which people don't associate with anxiety. So for anxiety, for generalized anxiety disorder is a problem that lasts for more than 6 months of anxiety. That could be palpitation, that could be shortness of breath, tremor, sweating. There could also be a feeling of things stuck in the throat. There could be tingling sensations like numbness of the hands, of the feet. There could be like tingling sensations of the ears or the soles of the feet. They could have poor memory, poor concentration, muscle aches like shoulder pains and neck pains a lot of times, poor sleep. They may feel restless. So they may be irritable as well. So there are so many different symptoms of anxiety that a lot of people don't realize is anxiety. For example, someone told me that they feel that their ears become hot every morning before they go to work. This is actually anxiety, but they don't realize it. So I think understanding the very varied symptoms of depression and anxiety would help to recognize these. So as to how best to recognize these symptoms in self or others, I think the most common symptoms would be poor sleep. A lot of people find that when they have mood or anxiety symptoms or problems, then they have poor sleep. A lot of people find that they feel that they ruminate a lot. They find it hard to concentrate. They may have a poor memory. They find that they get really forgetful, and that they may feel irritable, snappy, that someone at work tells them something and they snap at other people. This is quite a common complaint. They may feel that they have lower energy level, they are not motivated to do anything. So if these symptoms occur in one person or another person, then it's probably an idea to seek a professional assessment to see if there are any depression or anxiety problems.
Thank you so much. That's really helpful. Hannah, coming back to you, you talked about some of the trainings that you developed, or I guess informational pieces that you developed. One was around quarantine, to support employees in quarantine. Another I wanted to ask you about, since I can see we don't have too much time left, is some of the other training that you've long done around, mental health first aid, for example, and just whether you have, I guess, how employers use some of these tools and maybe why you developed them. Sorry, you're on mute.
I'm on mute. Can you hear me now? Yeah, so no, as I mentioned a few times at the start, everything we do is in response to members. So they came to us, for example, and asked us to do COVID-specific training courses. We held a recent member sharing session where a quarantine support resource came out of it, because we identified that there were a number of quarantine support, mental health support for the individual. So, how to practice mindfulness for the individual, but there was nothing aimed at employers to support employees who may be working. So that's just an example of one of the resources we put together based on what we were hearing from our members. And yeah, as I mentioned, many training sessions around managing virtual teams. Just general awareness training has been very popular this year. I think that's so key, from what Dr. Wong was just saying about the symptoms of anxiety and depression. It's so key that team members, managers, employees of all levels understand the need and to identify these behavioural changes in colleagues and be able to signpost, not diagnose, just to signpost to where the resources are to help, because I bet a lot of people just don't know these things.
Have you had any of your members talk about some of the challenges in noticing some of these signs or symptoms when people are working with each other over a computer? So they might be working on Teams or Zoom. There might be a camera on, there might not, which I think makes it much more difficult to sort of identify in each other, any kind of changes that you might see. Has anyone talked about that? I
think, yeah, we just discussed the behavioural changes. So if a colleague always has their camera on and then suddenly they don't have their camera on, that's a change. So just check in on them, and the opposite way, just if you're close enough to be working in a team and you notice something, then really the advice is to firstly just check in and just ask if they're okay at the beginning.
Thanks. We have a question from the audience, and I think it's a really good one. Is there a gender difference in mental wellness? So, for example, are women experiencing symptoms of mental ill health more than men are, or even are mothers experiencing some of these symptoms more than others as a result of some of the effects of COVID? And I'll open that up to anyone who wants to answer.
Well, I guess I can chip in and start the ball rolling. Interestingly, so COVID is very stressful to everyone, and indeed a lot of women are finding it very stressful, such as the schools were closed for a long time and then they have to work and balance childcare as well, so they find it very challenging. Interestingly, men also find it very challenging because there is just a lot of changes at work, a lot of changes in the family as well. Yes. Kids didn't used to go to school, but now they're or kids used to go to school and now they're at home all the time. People find that there's a lack of personal space when they are working from home all the time, having a lack of work-life differentiation as well. So I think COVID is affecting male and female quite equally. Yeah. So perhaps there could be a difference in stresses, but then the outcome, that the resultant stress, I find that there is quite a balanced gender. Yeah.
Interesting. So the effect is really around kind of disruptions, I guess, and parents would feel that disruption in their home. Maybe they might experience it slightly differently, but the experience is still there.
That's right. Yes.
Yeah. I'll pause there if anyone else wanted to chime in there. No, we're good. Pian, I wanted to ask you something that Hannah touched on earlier was employees asking about other types of services, such as employee assistance programs. I'm not sure sort of what Manulife is offering in that area, but have you seen a sort of renewed interest, I guess, in those types of adjacent services? So it's not classic benefit coverage, but these are sort of additional services, at least for employees.
Yes, employer can ask us to add this benefit to their employee, and also some employer will directly contact with the organization, such as the Hannah's one, to organize by themselves. Because honestly, a lot of any things related to mental health should be more confidential. So if the employer can directly contact the organization to arrange this kind of thing, maybe much better for keep the things more confidentially. And also, if you come to me and all insurance company, we do not have this kind of experts in our company. I will also outsource this to some organization provide this mental assistance program. What we can provide is only the coverage. We can provide extend our coverage to this kind of program or more alternative treatment other than traditional Western treatment, such as art therapy, music therapy, and this is also welcome to the employer, honestly, and also depend on how much it will cost. Yeah.
Okay, thanks. I'll pause here. I wonder if there's anyone from the audience who has any questions. If we haven't seen too many come through in the chat, but you know, if anyone has any questions, feel free to go ahead or let me know. Okay, in that case, I actually have a few more. Dr. Wong, you talked about your interest in a wide range of different types of therapies. So, you know, you're a practicing psychiatrist, but you're also very interested in, and you practice counseling and different types of talk therapy, you practice hypnotherapy. I think there might be a lot of people here who are not aware of the different routes that people can take to receiving care and treatment. And I'd be interested to know a bit more about that.
Right, so if you want to go to the private sector, the accessing treatment is easy. Basically, you just turn up, or you make an appointment and then turn up. so that would be quite easy, as long as you can find who you want to, if you Google and then find who you want to see and then make an appointment and then you turn up, then it's pretty easy. In the public sector, it will be more difficult because you can't choose who you see, you can't choose where you see, where you go to the clinic, because in the public sector, the outpatient service is tied to your residential address. So you can only go to a particular clinic according to your address. And also some people, if they face a particularly severe problem, then they need to have some inpatient treatment. Then in the public hospital, then you can only go to a certain hospital, depending on there's a whole flow chart as to where the person would end up in. In the private sector, that would be a little bit challenging as well, because most private hospitals do not take patients with a psychiatric problem. So only Gleneagles Hospital would have a behavioral ward where they take people with a mental health challenge. So I guess the ways to access services to really go to the right place and right person, otherwise you'll get turned away.
Okay, thanks. I think we have another one, a couple coming through. One is, why is it that having a history of mental health pose a barrier to people who are trying to purchase insurance? Pian, I think that would be one for you.
People suffering from mental health, and then from the research and data support, people if the same people and suffering from the disease, the treatment time and the treatment cost will increase, because I think we will the people suffering from mental health may need longer time for treatment, and then may not easy to be 100% true when compared to the mental health people. So for the traditional data support, people with mental health may not easy to buy a medical product. However, they still can buy some life product, depend on which kind of mental health, because one of the critical point for the insurance product is the chance of suicide, because for the first 2 years, we will not pay any benefits to suicide, but after 2 years, if suicide and the people is dead, and then we still need to pay. So the risk for insurance company for mental health, people suffering from mental disease is much higher. But in the coming future, we are also studying. Now we are studying whether we can further relax some criteria for mental health, because we have different layer of mental health, and then to find different category of the product. So maybe in future it will have some improvement, and then we can open the insurance market for mental health people.
Okay, so it really comes down to the practice in Hong Kong of excluding pre-existing conditions generally, and then the way that insurers are assessing risk of people who have a history of some type of mental health issue. We have another question here around whether there are some patterns that have been observed based on the industry that the person works in. So I guess, are we seeing increased sort of challenges around mental health depending on the industry, maybe financial services, teachers, the legal industry as well? Maybe I'll throw that out to the group.
I can just add a little bit based on the data that we collected from the 1,500 employees that I mentioned earlier. So we probably didn't go to teachers, but when we did a sector breakdown, the consulting industry came out on top as the industry that had employees that experienced more mental health issues in the last 12 months. But to be honest, very small. We had bank, financial sector, law, insurance, consulting were probably the main ones, and there were very small increments between each one.
Thanks. As someone who works in the consulting industry, that rings true to me. But it's been a difficult year for everyone. I guess we have a couple of questions that I think are good ones, and it's around stigma. And whether stigma is a particular issue in Hong Kong, and whether it acts as a barrier to people getting the help that they need, or the help they need either, I guess, from a doctor, or even just from their employers or their friends or their families.
Perhaps I'll chip in and get the ball rolling again. So I think there is a lot of stigma in Hong Kong, particularly in non-international companies. So in the public sector, psychiatrists, I think probably the only specialty where doctors can issue a attendance certificate without the department name. So all the other specialties, I think they have a department name attached to the attendance certificate, and also the job says which department has issued that particular letter or particular certificate. But in psychiatry, we don't have that, so it doesn't say psychiatry anywhere on that sheet to avoid stigma. And a lot of people, when they have sick leave, when they get sick leave certificates from doctors, they ask not to write any psychiatrically incriminating diagnoses. Yeah, and I actually personally know some people who received a lot of harassment from workplaces as well. So this particular person often tells me that he receives really, really harsh comments saying that, oh, you're crazy, you should go to the mental health ward, and you're just so useless, and this actually happens every several months from employers, from local employers. So I think stigma is very much happening in Hong Kong.
Yeah, and I can go, Pian.
Oh, thank you. I can supplement because sometimes the employee will checking whether the employer knowing about their medical history or their consultation history, how they use the good medical. We can ensure that the employer will only know that the total claims amount. They don't have the individual claims record, because if the employer need to get the individual claims record, they need to get the consent from the employee, and then we will get passed to the employer with the consent. Otherwise, we will not get this, because of why the usage rate of the mental treatment is low is that the employee are afraid that when they use this service, the employer will know that they are using this service, and then the employer will stigma them. This employee is not good. The employee will worry about the future career development in that company. So that is one of the reasons the usage rate is quite low. And then so we need to do more to ensure to the making some ensurement to the employee that the employer will not get the medical history from the good medical plan unless they sign the consent to the employer. Yeah, thank you.
Yeah. And and I was just going to say, with our data also, stigma was one of the top 3 findings of the report, and we found that the figure was 33% of employees who had experienced stigma either themselves or knew someone that had in the last 12 months. And when we compared that to that's really high, right? It's a third of people, but our data in 2018, so only 2 years before, the data was 55%. So there's actually been, the story is there's been an improvement, but there's still a hell of a long way to go. And stigma is one of the absolute top topics of what we do as well.
That's really interesting. So, we had another question here along the same lines that was around discretion. So, it speaks to the point that Pian made about the claiming, having some discretion when you claim, so that, your employers are not alerted to the benefit that you're claiming. But I also suppose a lot of that stigma needs to be addressed first and foremost by leadership, and so that it sort of trickles down to the organization. And I wonder, Hannah, just in these last couple of moments, is that something that your members also focus on, is sort of making sure that throughout their organization, they sort of address that issue of stigma from the top?
Absolutely. Yeah, I think we talk a lot about role modeling. What we hear from companies is that, the awareness raising around that it's okay, you wouldn't come to work with a broken leg, so why would you come to work with a mental illness? And that actually a lot of things are treatable. So lots of these discussions are being had at a senior level, and we've been told that they wouldn't have happened 10 years ago. So there's definitely signs are changing, and we just need to make sure that we continue and just keep the continuum going and keep the conversation going.
Great, thank you. It looks like we're just about coming up to the end of our time. So I guess, unless there are any other urgent questions, I would just like to say, thank you to our panelists for this discussion today. I think it's been really interesting. I've enjoyed being able to talk about these different points, not just the sort of medical aspect of mental health and the range of symptoms or experiences that people have, but also their experiences of being employees, trying to manage their mental health, especially through difficult times. So thank you, Dr. Wong, Pian, and Hannah, for taking time today. I really appreciate it. And thank you so much to everyone who took an hour out of their day. But I'm sure Zoom fatigue is real, and you have many things on either side of this call today. So thank you very much for everyone for attending. And with that, I guess we'll close the call today.
Thank you.
Great. Thank you.
Thank you very much.